This video is about the approach to altered mental status, and it's a mnemonic. The problem with altered mental status is that often the history is unreliable, the person in front of you being altered. If you can get collateral, that's great. But when you're in the ER, that usually doesn't happen, or has already happened and that person's gone, but that collateral hasn't been communicated to you. So often when you start the workup for altered mental status, especially a new presentation, and that's the presenting complaint, you're left with veterinary medicine, physical exam, and labs. Normally, I would not advocate for that at all. Of course, the path of clinical reasoning begins with the history. But more than likely, the nurse at the nursing home wasn't there when it happened, and it's not her normal nurse, and she's gone already, or the family member that told the ER staff has now disappeared. So, this is an approach to keep an idea of the common causes of altered mental status, the stuff you can easily get through. The advanced organizer is he stops for tips on vowels. He stops, tips, vowels. A, E, I, O, U. All right, let's go through the list first and then talk a little bit about them. Hypertensive or hepatic encephalopathy. E is for electrolytes. In particular, sodium can go in either direction, or calcium, usually hypercalcemia. These conditions in stops is the non-inflammatory brain-related stuff, such as stroke, trauma, opiates, psych, which means either faking it or psychosis, and seizure. These are the inflammatory and are lumped together. Temperature, infection, porphyria, because my mentor loved peas to make his mnemonics work, and sepsis. You notice they're all inflammatory and they're similar but not exactly the same. You can have an elevated temperature without an infection or without inflammation. Infection can mean of the brain parenchyma itself, encephalitis, or for whatever reason, the bladder and the brain of old people are linked. So it can be a direct infection of the brain or simply a UTI, even without sepsis or an elevated temperature. One time it actually was. A Tulane student had altered mental status secondary to porphyria. So there you go, included in the mnemonic. And also sepsis can exist without a known infection. Inflammatory response may be caused by anything. So all of these are similar, but they are different. A is for acidosis. E is for endocrine, especially the blood glucose, thyroid disease, and Addison's. I is a big one for intoxication or withdrawal. O is for oxygen, a low oxygen, or an elevated carbon dioxide. U is for uremia. Right, first, if you just look at this, you can get a lot of these off your list just with routine labs. Electrolytes and glucose, as well as uremia. Looking at hepatic failure. The CBC will help you push you towards one of the inflammatory conditions. A UTOX for intoxication and withdrawal. And then in order to get electrolytes and oxygen and carbon dioxide and acidosis, all you need is an ABG. So a lot of this can be done right away without even seeing the patient, which is good because you want information when you can't get it. And then not every patient who's altered needs this, but a CT scan will help with stroke and bleeds and trauma. And I'm not saying you should reflexively get this. I'm just saying that you can get a lot of information and start knocking off a lot of the things on this list with just a few labs. Hypertensive encephalopathy occurs when they're hypertensive. Hepatic encephalopathy will occur with asterixis, and the patient will have acute liver failure or will be a decompensated cirrhotic. Stroke. If the person has had a stroke that's caused them to lose consciousness, that is probability and be altered. That is a giant cerebral stroke. That person is dead. You have to be careful though, because if they have had a stroke, they sound altered to you, but they think they're talking fine. Broca's aphasia, Wernicke's aphasia, any other kind. So be careful about calling someone altered when they're able to follow you and track, right? They may still be altered, and if it is from a stroke, just be careful because the stroke may not be causing altered mental status. It may be causing inability to communicate. Trauma is really focused on brain bleeds, right? Opiates, it's technically an intoxication, but belongs over here with the brain stuff and makes the mnemonic work. Look for pinpoint pupils. They're either faking it or they're psychotic. Seizure. Most people think of seizure as tonic-clonic activity. Right? The person falls to the ground, they shake, they wake up postictal. That is a seizure. That's normal. They all are altered. If you have a loss of consciousness and are postictal, you had a seizure. But if you had a seizure, you don't necessarily go loss of consciousness. One woman was admitted to a psychiatric hospital. She was hallucinating, seeing spiders. Then she would jump up on the bed and scream. She was given haloperidol for the hallucinations. Well, haloperidol reduces the seizure threshold, and she kept having more spider episodes. 1 week later, a neurologist did a 24-hour EEG and confirmed her hallucinations were actually seizures. Now, of course, that's super rare, right? But people who are altered and have status epilepticus, or worse, non-convulsive status, may be having a seizure and be altered. They won't even wake up. So if all else fails, grab the EEG. Talked about these guys already. Acidosis, endocrine, O2, CO2, and uremia are like guaranteed automatically on routine labs. The place I want to spend a little bit of time is on intoxication and withdrawal. When someone comes in altered, you're going to get a UTOX, right? That's guaranteed from the ER. But if they come in not altered, and you don't have a UTOX, and then a day or two later they're altered, really give consideration to benzodiazepine or alcohol. They may not admit they've done it. They may not have gone long enough to know that this is going to happen to them, but be aware of DTs if someone has suddenly withdrawn from alcohol or benzos. All right, so this is a list of considerations you should make when you first see someone who's altered. And we've lumped them into non-inflammatory brain, inflammatory conditions, sort of lab stuff. And you can get a lot of information from a little bit of labs and use the physical exam to determine what the correct diagnosis is. That's approach to altered mental status.